So childhood trauma can be emotional, physical, psychological, but what is the lifelong impact of having a childhood trauma?
Trauma affects how you feel about yourself. Generally, the child takes things personally. When bad things happen to the child, they believe it's because they're bad, so they have a lifelong sense of shame. Trauma affects brain development. So the brain circuits that regulate the emotions, stress, body modulation, social relationships, insight, self-regulation, impulse control. These circuits physiologically are distorted in their development under conditions of trauma. And then trauma also gives a person a sense of a world where they don't belong, where they're not safe, where they're not going to find help, and where they have difficulty trusting other people, or on the other hand, they trust some people too much when they shouldn't. So it distorts development in multiple ways. And these effects can be lifelong, and they can lead to physiological and mental illness.
And is it inevitable, though, that someone who's suffered childhood trauma will go on to have problems? I mean, presumably some of them don't.
It's not inevitable, but the more trauma or the more difficulty you experience, the greater the risk of these problems accruing and then cropping up in adult life. Now, if a child has a traumatic experience, but has a nurturing adult or a trusting mentor or a trustworthy mentor, that can mitigate the trauma and promote resilience. But what we can say is that the more negative experiences a child has, or the less positive experiences they have, the greater the risk as adults along the whole range of health concerns.
And it can happen at a really early age, can't it? You know, as babies, even in the womb even.
We know now from multiple studies internationally that when women are stressed during pregnancy, that has a negative effect on the child's brain development and makes the child more at risk for addiction, mental health issues, behavior problems, and so on. So really the prevention of mental health problems needs to begin at the first prenatal visit by dealing with the stresses on the woman. And we know this from multiple human studies and animal studies in the laboratory.
And you bring your experiences to your work, don't you? Because you suffered trauma as a baby.
Well, I was an infant, a Jewish infant, under the Nazi occupation in Hungary, in Budapest. And my grandparents were killed in Auschwitz, and I lived my first year with a mother who was deprived of her husband, had lost her parents, and who was in daily fear for our lives. So that had a huge impact on my own development, and that showed up in my adult life, in my relationship, in my work, and very much in my relationship to myself.
And when you were a baby, your mum took you to a doctor, and the doctor said something very interesting about babies like you.
It's actually, the Germans occupied Hungary when I was 2 months old. I think it was March the 15th, 1944. And the day after the Germans marched into Budapest, my mother phoned the pediatrician to say, would you please come and see Gabor, because he's crying all the time. And the pediatrician said, of course I'll see him, but I should tell you all my Jewish babies are crying, which simply indicates the exquisite sensitivity of infants to the nurturing adult's emotional states. So that the child's health really depends on the emotional health and social support that the parent has. So in a society where, or in a situation where there's less support, more isolation, and more stress on parents, you're going to get more and more troubled children, which is what we're seeing across the Western world right now. And all these diagnoses that we're seeing with ADHD, which I've been diagnosed, by the way, personally, mental health problems amongst kids, anxiety and so on, the increasing violence, the autism problems, these are related to stress, not bad parenting, not parents who are mean parents, parents who are loving but who are stressed and they don't get the support they need. Increasingly, we're seeing more problems burgeoning in the childhood population.
And we use this term now, adverse childhood experiences, yes, commonly known as ACEs. I mean, how useful is it to use that term? Is that reductive, do you think?
It's not reductive, it's simply a statistical fact that you can't argue with, which is that an adverse childhood experience is physical, sexual, or emotional abuse, violence in the family, a parent being mentally ill, a parent being jailed, a parent being addicted, a divorce. And for each of these adverse childhood experiences, statistically, the risk for adult problems, such as mental health issues, psychosis, ADHD, addiction, autoimmune disease, malignancy, go up. Now, the childhood experiences don't explain why these things happen. That has to do with physiological and psychological development, but they provide a statistical grounding for us to know that in order to raise healthy children, we have to prevent as much as we can these adversities from occurring.
But to use this term ACEs, could it not stigmatise people to say that you've got ACEs? And could it also not almost be a self-fulfilling prophecy that if you have so many ACEs, you are not going to achieve in life?
No, it's not a prophecy. What would you rather believe, by the way, if you come to me as an addicted person? That you're addicted because you're a moral failure? Or you're addicted because you've got this uncurable genetic disease? Or you're addicted because you have so much pain because of your childhood experiences, and if you deal with that pain, you can heal your addiction. So the adverse childhood experiences, we actually know, there's a study that showed that in a medical office, when people are asked about their childhood experiences like that, they visit the doctor, they have fewer doctor's visits later on, because just the fact of being listened to and having their experiences validated makes them less prone to get ill. So this is not reductive, and it doesn't stigmatize, it simply helps people understand their experience.
So how do we best support people then who have suffered from childhood trauma?
First of all, by not blaming them. So if you take the addicted population, which is, I worked with a heavily addicted population in Canada, they're stigmatized, they're ostracized, they're illegalized, they're beyond the pale. What if we saw them as people who have suffered tremendously in childhood, whose addictions, whether it's to sex or gambling or shopping or drugs or alcohol, the 4,000 or 5,000 people every year in Scotland who died because of alcohol-related diseases? What if we didn't see them as derelicts or as failures? What if we see them as people who've suffered and who need support to heal their suffering, and then maybe they can give up their addictive habits? So this is a very hopeful perspective. It actually means we can do something, as opposed to this unscientific genetic idea that addictions are due to inheritance.
Yeah, you say that addiction, it's not a choice.
No.
But surely at some point it is a choice for everyone.
Have you ever met a single person in your life who woke up one morning and says, my ambition is to become an addict, my ambition is to be an alcoholic?
But if you say that people don't have a choice, does that not kind of absolve them of any responsibility?
I don't say people have no choice. What I do say is that when people are unconscious and in tremendous pain, their range of choice is greatly limited. And not only that, their brains are affected by those early experiences in such a way as to make those drugs highly desirable physiologically. So the idea is, if we want to give people choice, genuine choice, let's give them genuine support.
But do you not accept that if you say people don't bear any responsibility for that, for the things that they do because of what they occur to them as children, it's almost like a get-out clause?
It depends what you mean by responsibility. If by responsibility you mean blame, I'm completely uninterested in blaming anybody for anything. But if you're asking me, how to have people become responsible, how you help people become responsible, being able to respond to their lives, is by compassion and by helping them heal. Not they become totally responsible. So everybody has to take responsibility. If the person is not willing and capable of taking responsibility, they're not going to heal. So my perspective doesn't remove responsibility, it just supports it, actually.
So do you think then that in medicine, doctors should kind of think about what trauma people have been through before, when they discuss their illness almost? And the problem with that is that in Scotland, at least, you get 10 minutes to see your doctor.
This is a universal problem. But the main problem is that the average medical student in Scotland, and Scotland is a great medical tradition, as we know, but in Scotland, in the UK in general, in North America where I work and teach, the average medical student doesn't even hear the word trauma once in their training. They don't get a single lecture on the impacts of trauma. They don't get a single course on how to correlate people's life experiences with their illnesses. And so that not only do we have limited time, we also have limited education. And this is not the personal failure of individual physicians. This is a systemic failure that we have a very narrow view of disease and of human beings.
Because you think that childhood trauma is linked to autoimmune diseases like diabetes and cancer as well?
I don't think it. There's a strong statistical correlation. And we have this scientific knowledge to show the relationship. Because, for example, the more trauma you experience, the more stress you can experience in your life. Stress diminishes the immune or suppresses the immune system, and it deranges the immune system. And so that, yes, the more childhood difficulties you have, the greater the likelihood of you having rheumatoid arthritis, which also means that when you see the physician for rheumatoid arthritis, it's not enough that they give you pills for the inflammation. They should also talk to you about the stresses in your life, and that will help promote at least mitigation, if not healing, of your autoimmune disease.
Have you got case studies to kind of demonstrate that?
Multiple.
Give me an example of one.
Oh, I know people who've had multiple sclerosis, who are typically people who learned in childhood to suppress their emotions as a way of fitting into their families, and therefore they become very nice and people pleasers. And when they realize that they don't want to be that way anymore, all of a sudden the multiple sclerosis gets better over time. And there's been studies showing this in rheumatoid disease. I mean, the whole problem is that we're not looking at the evidence. Western medicine, for all its amazing achievements, and I'm a Western trained medical doctor, I know how powerfully effective our methods can be. But when it comes to chronic conditions, because we separate the mind from the body, we are not very effective.
So are you saying that everybody that gets these diseases has had trauma in their childhood?
You know, I don't want to be dogmatic about it, but I can tell you that I've traveled all over the world, I speak in multiple countries, I've looked at the medical literature, I've yet to see the exception. Somebody with autoimmune disease, for example, I've yet to meet somebody or read about anybody who was not suffering from a combination of emotional and physiological problems. I mean, here's the reality. You can't separate the mind from the body. Physiologically, it's not possible. If I were to scream at you right now, that would change your physiology in a split second.
But you're kind of implying that everybody gets ill. Something must have happened to everybody when they were a child, and is that not just life?
How about not putting it that way? How about if I said, everybody who comes in with an illness, at least it's worth inquiring what happened to them, and how what happened to them is affecting their life today. So that's an inquiry. If the individual does not want to partake in that inquiry, nobody should force them to. But I can tell you multiple examples of where that inquiry is engaged in, people actually do better.
If you are so sure of this, why does the medical profession not, you know, approach treating disease in that way then?
Do you have 3 hours for the answer? A, because they're not taught to think that way. We separate the mind from the body.
But that suggests that there's not the evidence.
Sorry?
That suggests that the medical profession as a whole doesn't think there is evidence to support that.
The medical profession doesn't look at that evidence. There's lots of evidence published in medical journals. The relationship between stress and disease, the relationship between early childhood experiences and disease, the way that emotional factors affect the immune system. There's nothing new about this. Mm-hmm. People have been studying this for decades and decades and decades. And so what I'm saying is that the Western medical mind is trained not to look at certain evidence that it doesn't feel comfortable with. And let me quickly throw in one more thing, which is who funds medical research? Pharmaceutical companies. There's no profit in studying this because you can't make pills for stress.
But are you saying then if you could trace back to a person's childhood that they did a trauma and they were now suffering from multiple sclerosis, that you would give them therapy rather than drugs?
I didn't say rather.
So what is the benefit then in knowing that someone has ended up with this disease because of what's happened to them? What is the benefit of knowing that?
Well, because if somebody needs medication for their multiple sclerosis, they have a flare-up, of course they should have their medication. But let's have a conversation now. Once you're feeling better, let's have a conversation. How stressed were you before your flare-up? What caused the stress? What was happening in your work? Did you take on too much? Did you have trouble saying no? Was there a marriage difficulty? Can we deal with that? Can you learn how to be more effective in dealing with your stresses and maybe prevent the next flare-up? So it's not a question of either or. I'm not saying we should throw out Western medicine. I'm saying it's missing a huge part of human experience that if we added it, our medical practice could be so much more effective. As you suggest, that would take more time, but it would also promote a lot of health.
Do we then blame our parents for everything that goes wrong with us then, with our behaviour, our illnesses, you know, our personality? I mean, it comes down to nature versus nurture, doesn't it?
Well, it's not versus, first of all. It's nature and nurture, number one. Number two, there's no room, as I said earlier, in my worldview for blame. Parents do their best. I did my best as a parent, but you know what? I was a traumatized adult. I hadn't dealt with my trauma yet. I inevitably passed on some of my trauma to my children. It's not because I didn't love them. It's not because they didn't do their best. It's not because my wife and I didn't have our children's best interests at heart. But our best was limited by our own degree of consciousness and our own degree of having resolved our trauma. And so it's not blaming anybody. It's just saying that trauma actually is multi-generational. There's nobody to blame. The thing is to understand it. And if you understand this link of trauma that can be passed on, the question is, what can we do to interrupt that, to break that chain?
And how can you break the chain?
By healing, by bringing healing to each generation, by looking at the factors, social, psychological, economic, emotional, physiological, environmental, that affect human beings, and by dealing with all that as effectively as we can. It also means medical policies and governmental policies that support people, that support communities, that support contact and connection between people rather than isolate people, that do not stress people, because we know what stress does to the intestines and to the brain and to the immune system and to the heart. I mean, there's so much we could do with this information. If we had not a bit more research, just apply what we already know or should know, we would have a much healthier system.
The Scottish Government launched a strategy last year to tackle social isolation and loneliness, as both are recognised as having effect on your physical and mental health. I mean, are physical and mental problems, you know, really exacerbated by a lack of kind of human connection in modern living, do you think? Well,
that's one of the impact of modern capitalism, is that it isolates people. It promotes the idea that people are aggressive and individualistic and selfish because of the policies that have been in practice now for close to 3 or 4 decades. Community supports have been diminished, I know in the UK and also in North America. Communities are more isolated. There's less and less sense of contact between people. And as a result, what are we seeing? We're seeing more addiction, more people dying of addiction. We're seeing more mental illness. We're seeing a rise in autoimmune disease across the Western world. This is what we're seeing. And loneliness, as you mentioned, kills. Because people are biopsychosocial creatures, which means to say that our biology cannot be separated from our psychological and social relationships and our emotions. We're all of a piece. And to be healthy, all the pieces have to be looked after.
So, I mean, we don't have time to go into all the things that we should be trying to do, but you talk about how, you know, very early childhood is really critical. Yeah. And in the UK, parents can take up to a year's maternity leave. Yeah. It's much better than America, but not as good as Scandinavia. Should we almost be really, you know, trying hard just at that very early stage to try and make a difference, to try and prevent these childhood traumas actually happening in the first place?
Well, you see, if you were talking to a gardener or anybody who practices animal husbandry, would it be controversial to say that how you plant that seed or how you treat that pregnant animal and their offspring in the very early days will make a huge impact on their adult development? It's not controversial. Why is it even a question? I don't mean why you're asking me personally. It's a good question in the context of this interview. But socially, why is it even a question? It's just obvious that the earlier you start taking care of human beings and the more grounding you give them to be healthy, the more they will thrive and the more effective they're going to be in their lives. And so yes, we need to start very early, as I said, at the first prenatal visit. And schools need to be informed about this stuff. See, the child's brain develops from in utero, begins developing in the womb, and it continues until, the brain development continues until your 20s. Which means the schools are actually in the brain development business. Mm-hmm. Or they should be. But how many lectures does the average teacher get on brain development? And what conditions promote healthy brain development? Mm-hmm. When you yell at a kid, when a kid acts out, when a kid behaves in ways that are not socially acceptable, it's usually because they have some kind of emotional pain that they don't know how to resolve. Now, what do we do with them? We punish them, we exclude them. Mm-hmm. What does that do? Exacerbates the problem. What if the educational system was actually trauma-informed? What if the educational system actually understood the importance of relationship in the healthy development of children's brains? Then they wouldn't be so focused on trying to control behaviors and on cramming facts. They'd be saying, well, what conditions do kids need for them to develop in a healthy way so they'll be curious and interested in learning and socially responsible and comfortable and confident in themselves. These are the questions that governments should be asking, that educational systems should be asking, that the medical system should be asking. And these are totally reachable goals given our resources and our understanding.
Okay, well, it's been absolutely fascinating to talk to you. Thank you very much indeed for joining us in Scotland tonight.
My pleasure. Thank you.
Thank you.